Hi, my name is Francesca. This is my funeral services capstone on care and embalming. I'm a second semester student at PIMS. I graduate from PIMS in September, and I did 2 years of general education credits at Point Park. I graduate from there at the end of this month. So I wanted to touch on some questions that I didn't necessarily answer in my paper. Why did I choose funeral services? I was in various programs in high school trying to figure out and navigate what career path I wanted to go down. Specifically, I was in a criminal justice and homeland security program for 2 years, and that program introduced me into forensics, which then led me to considering becoming a medical examiner. And then from researching that career specifically, I found out about embalming, and I thought embalming better suited me in my strengths in science and art. I will later explain why embalming and forensic medical autopsies are two different processes, but that was why I got into this. And another influence on why I decided to go into this was my dad, because he's always been a big influence on my life. His outlooks on life and death has always influenced me and taught me to embrace it and not be scared of it, but to also accept it as part of life. And I know that there's a stigma and stereotype about the type of people that go into this career field, but he's also been a major sway in me not fearing that necessarily, because I know that this is not about me. I'm more concerned about the care and the help that I can provide for other people. So, preparation for the industry. I have no family connections to the funeral industry, so anything that I knew or thought I knew about the industry was from my own research online or books. I followed a few funeral directors on social media. I would Google things. I read books, like I said, but there was still not much I knew. Since I didn't have that connection, I didn't really know how to approach things. So my senior year, I reached out to a funeral director in my hometown, and I was able to answer some general questions. This was for my high school project, but even then, it still provided me some insight into what it would be like to enter this field, and kind of gave me more direction into how to go about approaching that. So then my freshman year of college, I shadowed at Jefferson Memorial for a day, and that was my first time kind of stepping foot into the industry a bit. I had not really been to any funerals in my life, so this was my first time being up close and personal, seeing the process a little bit behind the scenes, and the works around that. And then 3, Point Park University and PIMS. Point Park, like I said, is where I took all my gen eds. Nothing was quite career specific, so I took a bunch of English and psychology classes. It is primarily a COPA school, so for a niche field like mortuary science, as a funeral services major at Point Park, it was just kind of hard to navigate and answer any questions about how to enter this field or how to go about transitioning into PIMS, because at the time there were no PIMS faculty members or staff that was there to help or answer any questions, but my advisors did put in a lot of effort and work to help answer questions as best they could and find an answer for me. And my advisor, Mark Mernick, was how I was able to shadow at Jefferson. So at Point Park, I was taking 18 credits per semester, and at PIMS, I take about 20 to 21 per semester. So Point Park provided me a solid foundation in terms of how I study and manage a heavier course load, because at 18 credits a semester straight out of high school, that's already a full and heavy course load. So I didn't initially know how to study or manage so much going on at once. And so that's where I finally was like, okay, let me establish a good routine and a way that works best for me to study. And that helps me a lot at PIMS, since it's an even heavier course load and it's more specific to what I will need outside of the school. At PIMS also, that's where I finally felt like things were coming together more. I was provided more opportunities to speak and listen to professionals in the industry, and attend different events, including continuing education seminars. I've also gained hands-on experience, and all of this has helped prepare me for a career in this industry by letting me learn and make mistakes, so I hopefully don't repeat them again in front of families. But it also has allowed me to make connections among peers, professors, and outside of this. A specific event that we were able to listen and sit in on was a trade embalmer Zoom meeting, and that gave me quite a lot of insight, which I touched on in my paper. She specifically talked about how it's important to work as both an embalmer and a funeral director, to really understand the care that needs to be given and that whole part of that, which I will later explain. For managing anxiety surrounding mortality, death, and dying, I will say that Point Park kind of touched on this, because I did take a few forensics classes and psychology classes, so that was a big help in understanding emotions and just like baseline things. But at PIMS, we talk extensively about the whole process of embalming and walking you through that process and understanding what you might see, what you're going to do, and how to navigate these things was really helpful in managing this, because I kind of already knew what I was going to get into. Obviously, seeing it in person is a different thing, and that's why PIMS does the observation that you are required to attend on the 3rd floor. And that was my first time seeing a process. I didn't know how extensive embalming was until that point. But also managing anxiety and all these other issues. Any funeral director that I have spoken to has always mentioned having a support system, hobbies, or other things to ground you, just prioritizing something outside of work to decompress and prioritize and recognize your needs. And so that has been a great help, because also you just need to know when you need to take a step back and recognize when something may be getting to be too much, and being able to step back and do that is a great help, because you can't really do anything if you're stuck in a certain state. So these are my contents of this presentation, which are just like general breakdowns of what my paper was about. What is embalming, the goals and objectives, education and experience, embalming versus autopsies, so I will be diving into a case example, the medical examiner's goals and objectives, and then 4 is my reflection and personal takeaways from all of this. So this is a quote that I started my paper off with. It's from one of our required texts at PIMS. It says, "Funeral service is not a job, it is a service, or in some areas a ministry. It relies on individuals who respect themselves and others. They treat the deceased, family, and community with respect." And I just thought this applied to my general topic. So, embalming. So the 3 main goals and objectives of embalming are to disinfect, preserve, and restore. Disinfection destroys or inhibits most pathogenic organisms and their byproducts in or on the body. So this prevents the spread and growth of disease to protect the general population and to slow down the decomposition process for things such as viewings. And preservation is the use of a chemical to disable saprophytic bacteria. This aims to slow decomposition by changing body tissue into a form that is less susceptible to decomposition. So delaying this decomposition and preserving the body is of utmost priority and allows for more time, whether that is for family members traveling into town or otherwise. And restoration are treatments conducted to recreate natural form and color. This aims to get the decedent to a recognizable and presentable state. The viewing of the body one last time may be a crucial thing for a family because of cultural practices, but also major and minor restorations, in addition to the preservation of the decedent, can provide a great service to families. Restoration may require a lot of time, effort, and skill, depending on the body's condition, what trauma has occurred, and etc. But it serves several purposes beyond just identification. These also include psychological effects on the loved ones, dispelling any imagery from rumors, personal satisfaction, professional responsibility, and that coincides with no one else being able to do what we do. There are many considerations that go into embalming. There are a lot of technical aspects, which is what can be seen in these goals and objectives, but ultimately, what we do in terms of technicalities pays off for the families that we serve because the restoration and the presentation are acts of care for the families. Education and experience. I began embalming in January of this year, so I've only embalmed 13 people so far. Our clinicals are something that we get to do to get hands-on experience before entering the workforce. This is education that really cannot be replaced by anything else, so I'm really grateful to have had the opportunity to learn this way. We take embalming orientation before entering this class and before entering the prep room, and we also gain our trainee licenses. There are a lot of considerations that go into embalming. We do case analysis, as not every decedent is the same, so they're treated differently in terms of chemicals, but also we consider other things such as how far out their viewing's going to be, and even if they're not being viewed, just making sure that we did our due diligence and making sure that that person has been properly embalmed with care. The schedule's what is it like? Typically a team goes about once every 2 weeks. Sometimes you can get called in to embalm with another team, depending on the amount of cases on that day. And there's a set weekend schedule. I have a team of 5, and every single time that you embalm, there's different proctors. So it really just depends. It also depends how long you're in there for, based on the case analysis and how many individuals you have there. We embalm people from different funeral homes that the schools sign contracts with, and a lot of cases from the medical examiners as well. Requirements: you have to embalm 20 people at least, and there are different requirements while you're doing this. There are 3 different zones or levels that you can be in. There's red, yellow, and green. As you work your way up, you're worried more so about what types of arteries you're raising, what types of suturing you're doing, and etc. And it can be kind of easy as a student to get caught up in that fact, but as far as care goes, a proctor that really emphasized the work that we do on people and the care that we give was Miss Obermeyer, and she really emphasizes that the people we work on are people that have names and that they were somebody's mother, father, sister, friend, or whatever title they may have gone by to different people. They're human, and that it's the forefront of who they are. So it's an honor and a privilege to be working on them, and we should be thanking them for the education that they have provided us. So it is also good to make note of the different proctors that we have worked with in our rotations, basically, because with every proctor, they have different techniques and skills that they've honed over the years from their proctors as well and their mentors, and they make their own twists on it, and it just like gets passed along through other students, but also we take our own twists on things. So there's a million different ways to do different things, but yeah, in terms of embalming, Miss Obermeyer again has taken the time to acknowledge that we did put in the work and we did take the time and that we treated everyone with respect. So remembering what they came into the prep room looking like and how we're sending them back is a big thing, because we take pride in the work that we've done from start to finish. And as embalmers that don't meet with families, I think it's really important to do this because of the circumstances in which we embalm. Since we're not meeting with families, remembering this is very important because of that bridge and gap that's there when you're not meeting with them. Embalming versus autopsies. So this is my embalming case that stuck with me the most. It was a 22-year-old male with a full autopsy. So there was a Y incision from here to here. He also had a cranial autopsy performed. He was a long bone donation, and he also had some other organ donations. He had a wound consistent with a gunshot, and another thing to make note of was there was an incision made on his back or his posterior side, so that was important. So lasting impressions for this were the posterior incision, his hair, and care. The posterior incision was just something that we hadn't noticed until we had rolled this decedent to dry off after embalming and like clean his backside. And oftentimes whenever I speak to other funeral directors or other students that have worked on cases from medical examiners, they often will talk about how sometimes there will be like extra cuts or nicks or something, and it looked like our proctor had initially thought that they had begun making a Y incision in his back and then suddenly stopped and then sutured it back together. So we were just confused as to why that was. And oftentimes we can only just make assumptions. We don't know what's happening. Maybe there was a reason why that was happening, but for me, that's just what stuck with me. He had long curly hair, and it had been matted, and there's a part of it that was shaved. But it was just very long, and I remember a team member of mine had thought that they must have cared for his hair a lot in his life, and so she took a lot of effort in trying to detangle it and make it presentable. And something else about his hair was that there was a chunk of it in his like upper chest, and that was just something that really like stuck with me because it was his hair from his head, and it should not have been there, and it took 2 seconds to throw away. And so that's why I ultimately was thinking about care and levels of care and whether or not that was performed at all, because I know, like I mentioned, my proctor, Ms. Obermeyer, has taken the time to recognize that each decedent that comes into the prep room is a person. Sometimes, like, when things like this are presented to us and they come from the medical examiner's office, that just makes me think about whether or not they're taking the time to acknowledge this as well. So the goals and objectives of autopsies are identification, determination of the cause of death, confirmation or refutation of the assumed manner of death, and to estimate the postmortem interval. So obviously their goals and objectives are different than embalming, but it can be pretty evident and clear that the medical examiner is not concerned with presentation like an embalmer or funeral director would be. A quote from one of the sources that I pulled online was, "While pathologists have extensive knowledge and training, it's important to remember that they're human just like the rest of us." While embalming and autopsies are two different processes, one can acknowledge that while medical examiners are human and make mistakes and face obstacles and hardships in their professions with time constraints and high caseloads, you can also address the fact that the various states and conditions in which decedents are sent to in the preparation room can be arguable. This is not to say that all medical examiners are like this, nor do all decedents that have been autopsied come in these ways, but the ones that I have personal experience with and observations with, I think it's enough to be notable and recognizable. So what? Autopsies can expand medical knowledge, unveil genetic conditions, provide legal evidence, and answer some questions. And this can allow families to have some type of closure after their loved one has passed. And my last talking point is my reflection. So the 3 points that I wanted to touch on in my reflection are a disclaimer, assumed care, and pride. I'll start with assumed care first and kind of work my way around, but assumed care, how easy and can you tell, is referring to when we work on decedents from the medical examiner's office. You can make assumptions about the lack of care or the care that was provided based on how easy they make our jobs, such as like them putting a notch in the calvarium. I know some people don't like that, but that was one of the things. Having clean and precise incisions, leaving arteries untouched, or are they cut? Are they easy to locate? Also, the state of how they come into the preparation room in their bag. Are they covered in their own feces or otherwise? So that's just something to reflect on. That's swayed my opinions on autopsies and like having being an organ donor. While I wouldn't push this onto families, that swayed my personal opinion because I think there is a level of care that should be taken that I think can fall short from what I have seen, which is why I left that disclaimer in there, because I understand that not all medical examiners and not all decedents that come from the medical examiners have this, but I think, again, it's enough for me to notice and make recognition on and express my frustrations. So that's what I wanted to talk about. So my last point was about pride. Aid and guide families, who else can do this, and dignity. So after the embalming case that I touched on, I definitely have been more cognizant of the work that I do in the preparation room and like how I conduct myself in there. I think that being able to do this and continuing to do this is very important. And I've grown very proud of this industry and the individuals that work in this industry, because it's very evident that death and dying is not pretty, and it can be very tough with cases like this that are a little closer to home to you, because the 22-year-old was very young and he's close to my age, and that was just something that I had thought about. And so being able to look past these things and understanding that there are families of this person that you're working with and working on is super important. So being able to guide them and aid them on their journey of grief and putting them on that track, I think has definitely aligned with why I wanted to go into this industry. And I'm also very proud to be working as an embalmer through the school, because of the dignity that we give these decedents and ensuring that they are dignified in their last moments, because we're always working to perfect and fine-tune every detail until their final disposition, and trying to make sure they're as good as they can be to the best of our abilities, and knowing that we gave it our all is a great deal of importance to me. So that was my entire presentation. Thank you so much, and these are my references.